Occupational therapy focuses on adapting the environment, modifying tasks, teaching skills, and helping children develop the skills that they need to grow into functional, independent adults. April is Occupational Therapy Month, and Turn Center is shining a spotlight on the therapists and the patients that benefit from the services there. Kalisha and Kaylee are in today from the Turn Center to talk a little bit more about what occupational therapy is, what it looks like, how it can benefit kids. So when we're talking about, we know what physical therapy is, we know about all of your other therapies that you guys, but occupational therapy in a child is maybe a mystery to some people, right?
Sure, and our name doesn't help.
Right.
You know, kids don't have jobs, so everybody thinks that we're getting kids jobs. But what we look at is how we can help a family improve their quality of life. So sometimes for kiddos, we are helping with developmental skills. We're helping them meet sensory needs. Sometimes we are helping them with motor deficits that they might have, just to help them improve and help the family's life work better as a unit.
Makes a lot of sense, for sure. And you do that through a whole bunch of different kind of venues and mechanisms and things like that, right?
Yes.
Okay, so let's talk about ILS therapy first, okay?
Yes. So this is actually kind of a new area that we are introducing at Turn Center. It's a treatment approach, I would say, where we have the child listen to different playlists of music that are different tones, pitches, and it also has a component to it where it gives them bone conduction through the headphones, so they're getting that vibration while the music's playing. And in that program, the different tracks are supposed to help with attention, concentration, fulfilling their sensory needs. And with that, we work in some motor components because we want to treat them as a whole and just not one area. So we'll work on different things like bilateral coordination tasks where they're using both hands, motor planning, some fine motor skills. We have seen with this program that there have been huge strides in different motor skill acquisitions, and then we've also had some kiddos that their communication skills have also improved since using it.
That's
so,
really cool.
yeah.
And something probably that the kids enjoy as well, right?
They do, yes. A lot of kids come in and they're like, I need my headphones before we can start working.
Okay,
so, yeah.
Very neat. Okay, so there's another sort of new area of training, right, called the reflex integration, right?
Yes.
Okay.
So this is also, it's new-ish for us, but it's I feel like it's an understudied area. Reflex integration, a lot of times, or all the time, we're born with reflexes, and typically by that first year, those reflexes should be integrated to where we can move our bodies how we need to.
Okay.
So a lot of times the kids that we see, all of their reflexes won't be fully integrated, and that can impact their motor skills, their communication, writing skills. So what we like to look at the clinic is if they have some of these reflexes retained, which I know we had a video that kind of showed.
Okay, so here's a photo first.
Yes, so in this photo we were kind of addressing the ATNR reflex, which is the asymmetrical tonic neck reflex. And so this is typically developed by 6 months of age, and you can see that her arm is slightly bent and so is her knee. If that would have been integrated, you would see that she could hold it perfectly straight. So with her, we're trying to integrate that, and she's done really well, and we've noticed huge improvements in her writing skills since we've started working on that.
Really interesting. Okay, now let's watch this video.
So in this video, she's doing something we call cross crawls, which works on motor coordination and bilateral coordination, and it has her crossing midline of her body, which is great to get right and left brain kind of talking to each other.
So so people are watching and they're thinking, okay, well that seems like really simple. Like, why do we need to do, this does, but sometimes these things don't come innately to us.
Right, right. And we live in such a world now where technology plays a huge role in what our kids are doing. They spend so much time on iPads or watching TV, and they aren't playing like I feel like we used to play. And so introducing these motor skills to them is so important, and it gets their bodies moving how we need them to.
Absolutely. Very cool stuff. Thanks for sharing, because I've actually always wondered about that.
Awesome.
All of these services are available at Turn Center. You can check out turncenter.org, but I also want to mention you'll have a greenhouse or a geranium sale coming up next week. So I wanted to, I know that people really, really love that. So you can check out their Facebook page for more information on that geranium sale benefiting Turn Center. Girls, thank you.
Thank you.
We appreciate you coming in. Stick around. After the break, we're going to check in with our friends from the zoo. They want to take care of our parks on Earth Day and